Hi everyone, welcome to our Monday Night Live. It's Piet and Grade here from the Purple House Wellness Center in Tasmania. We've had our wellness center for 20 years and looked after probably close to 20,000 clients by now between the two of us. And tonight we are coming to you with a topic that's close to our heart because it causes a lot of suffering and pain, and the topic is inflammation. So Peter, I'm going to pick Peter's brain because he's the guru. And Pete, can you just explain to us what inflammation looks like? Because a lot of people think inflammation, that's like a sore knee or whatever, or a sore back, but not many people know that heart disease is inflammation, diabetes type 1 is also caused by inflammation, and so on. And I've put a blog here. I'm going to put a blog post below the video, so please read it to really inform yourself. So Pete, what does inflammation do in your body and why is it so painful? What's painful about it?
Inflammation is at the base of every label that the medical world would like to give you.
So what is it though?
When you get the pain, it's your immune system trying to heal an area of body that has been starting to be broken down by oxidative stress, oxidation of which is...
Yeah, what is oxidation in layman's terms? I'm just really wanting Pete to break it down for us. What does oxidation mean and what does it look like on a cell level? Right?
It's when little what we call free radicals race around your body, pinching things off cell membranes and cause the cell membrane to break down. But it's the same as if your car radiator ran out of water and you went down to the sea to get a bucket of water and put in the radiator. Now, I quite often ask people that, would they do that? And I don't think there's been one person that's...
Okay, but I feel like you make a really big skip. But now between your cell membranes breaking down and putting salt water in your radiator, so where's the link? What causes the pain in your body?
The pain in the body, the blood rushes to the area to do the healing and causes swelling, which causes constriction of the tissue and the area around it. And if it's in a joint, then it can't...
It's really tight.
It creates pain. Swelling creates pain and lack of mobility.
Okay, so this
raises the blood supply there to do the healing with the white cells. The white cells do the healing.
And what happens to the white cells? They're like the army of soldiers, aren't they?
They're your immune system and they normally live 3 weeks. So normally if you cut yourself and it gets all gooey and sluffy on the outside of your body, they are all dead white cells come there to do the healing. Like
pus is dead white cells.
Pus is dead white cells. So whenever we've got pain and heat and swelling, that's the signs of inflammation. But quite often we don't feel that if it's on an internal organ or inside an artery and things like that. But inflammation is at the base of
everything.
Coronary artery disease. It's at the base of everything, and it starts when we're little kids.
Okay, but so what hope do we have then? This is a bit tragic. We actually do have hope. I'm just egging you on. I actually want to interrupt. Can I interrupt for a second? If you wake up in the morning, let's say sometimes it happens to older people like Pete and me, and you wake up and you feel like, oh, this finger is a bit stiff and sore, and I can't bend it as easily. But then during the day it gets all flexible again. Have you ever had that experience? right? Well, in the past, I used to believe, well, it's just one finger and it's okay, my body's okay. But actually, if it doesn't matter if it's your fingertip or your ear or your nose or whatever, or your big toe, it literally means information is happening right throughout your body, apparently. So it's good to take action straight away, like a stitch in time saves 9. If you have any information going in your body, which, you know, like what I just, that's one of the symptoms. I've put many of the symptoms in the blog.
Well,
you need a product that we've got. We'll just get to the point in case you have to stop watching the video. Okay, and then we go back to the subject again. This product is called Immuno-Synbiotic X-Flam, which is different to the Immuno-Symbiotic Restore. Many people use the Restore, which is a different function. This one is called X-Flam too.
Got specific or probiotics in for inflammatory.
Yeah, to reduce
problems.
the pain and to really address the problem at the cellular level, so that your body can heal from the inside out. So Pete, a story is sometimes way more illustrative than just going into the facts. I know that you have a very strong scientific brain.
I was about to tell a story about a client.
Yeah, go for it.
Who came to me, and he had some probiotics to control his gout, which was a problem for him, and he ran out and then had to have some more antibiotics for some reason, and the gout flared up.
Yeah. What is gout exactly?
It's normally caused through uric acid.
Asking for a friend.
Build up, but it affects joints and
they get sore and you can build up
inflammation normally in the toes, the feet, ankles, can happen in the wrists and fingers.
And then it gets calcified.
And he asked if we had the probiotic, and I suggested he try the X-Flam, Immuno-Synbiotic X-Flam, and it got rid of the gout again.
That's awesome.
For that client.
Mm-hmm. And he keeps using it, doesn't he?
He keeps using it. If he goes off it, his gout will flare up a little bit. So he comes and gets it regularly.
Mm-hmm. So why would you even go off it? Because it's not just to beat the inflammation. It actually heals and seals your tummy, and it restores your body from the inside out. I had a client with gout that was a she, and it was the same story, right? So, but then we also had a client with more severe crippling issues. So she had been injured in the past and got over her injury, and then but actually the shock and the trauma stayed in the body, and then over the course of the years she got this deep inflammatory issue where the immune system remained in shock, I guess, and kept on then in a sense self-harming the body. It was always being triggered, so she ended up losing a job and putting on a lot of weight, and then all her internal organs started to get inflamed, and
I guess they would call it an autoimmune
yes,
disorder.
it was called chronic regional pain syndrome. Maybe you've heard of it. That causes like extreme pain in either your hands or feet or legs. And the same thing. So she did need treatment from us, because when we give you a treatment, we actually hack into the computer and sort out the root cause. And the root cause is often to do with, a trauma that happened in your childhood. That you've lost all the memory around it, the conscious memory, I should say. But in the unconscious mind, it's still active, right? You could be living as if you've got a gun stuck in your head, basically, right?
It keeps the body in flight and fright.
Yeah, so she needed that, and then she also needed this, and that really settled her body down. So it's
where I was going with the putting salt water in the radiator of your car, no one would do that. And putting sugars in here will rust the inside of your body. So it's exactly the same as putting salt water in the engine of your car. You wouldn't do that but you can trade your car in.
Yeah,
But we can't trade our body in. So stop putting the things in your mouth that'll cause rust, which is inflammation, oxidation.
So rust is mainly comes from sugars, carbohydrates, a lot of the fruits as well. So in other words, Pete is saying sugar is to your body what salt water is to your car or to metal. So your body, when things go wrong, your body will do two things. Your eye will either rust or rot, right? To put it very, very simply now. So cancer is often more a process of rotting because the cells are deprived of oxygen. But with rusting, which is what we're talking about today, it's to do with oxidative stress. It means literally your cells feel as if they're on fire. Happy?
Being oxidized,
burning up with from triggers, from toxins, things that are toxic in your body. So your body will actually go one way or the other. And we can determine, by the way, through our testing, what your body is doing. Is it rotting? Sounds terrible, but it's true. Or is it rusting? And we can quickly reverse the process. That's what I really want you to remember. It might take your body 20 years to get to that point of pain and suffering or decay.
But the weak point cracks.
Yeah, your weakest link will go first. But actually your body recovers very, very quickly with the right help, because our bodies are basically self-healing machines. They really are.
If we give our bodies the right things they need to do the healing, it'll do the healing.
That's right. And even being kind to yourself and each other. And so I have salt here, right? So what about eating salt in? Or shall I answer that myself?
Well, no, we need salt, because what salt is
minerals.
Pure salt is about 84 different minerals and trace minerals that we are not getting in our food because they've been washed out to sea.
Right, so I teach all my grandchildren when they're here and have a salt bowl here. You can see how I haven't got much left. I tell them literally to stick their finger in and and lick it all day long, because they're never going to overdose on that.
And we need those minerals for the electrical conductivity around the body.
Because this is so strange. I say this to parents, and parents go like, "Oh no, I also hide my salt in the cupboard." But and you could be like that too. But I bet you probably have sugar on the bench, right, or jam or something like that. But then we hide the salt, but it needs to be the exact opposite.
Yeah, farmers put salt licks out for their animals, and their animals will lick them until they don't need any more. And children up to 8 years will do exactly the same. They know how much
they'll stop
salt they need, and they'll stop.
I've never had a child yet that got salt toxicity. Ever. I've never heard of it. And in fact, the opposite is true. Like many like little toddlers, if you get them to lick, some toddlers will lick the salt lamp because of course they know what's good for them, but it'll clear up their skin issues and like tantrums, lots of things. Just, sorry, my saliva is running from the salt. Just disappear from the salt.
But the things that do cause the inflammation that we put in our mouth again are sugars. Any blood sugar above 6, any glucometer blood sugar above 6 is causing inflammation. And it's the spike that will cause it. A banana will spike your blood sugar up between 8 and 9 for about half an hour. And it's rusting you in that time.
Yeah, rusting causes memory loss too, by the way. That's really interesting. Yeah. If your blood sugars go over 6.5, for a prolonged time, let's say a few hours at a time, every day, it's really going to affect your memory. And we all know that Alzheimer is also like epidemic proportions out there. Like Alzheimer already starts when you're 40, right? Except you can... you don't notice it, right?
You can camouflage.
But actually brain scans will show that before you start to lose your own name, what your name is, the process has already been happening for like 20 or 30 years sometimes. So again, it can also be reversed. So people don't believe that, but it really can. Alzheimer can be reversed.
And you may ask, well, how do I get my energy, keep my blood sugars up?
Yeah, okay. Just give
But
us
you don't need blood sugars to keep your energy levels up. If you change your fuel source to fats, you'll have far better energy.
Yeah, and Peter means
fats don't cause disease. They don't cause inflammation.
So fats, a good fat's a coconut oil. Peter's favorite is cream.
Cream and butter, coconut oil and meat fats. Beautiful.
And some of the nut oils like and olive oil is even good as well.
Macadamia nut oil, olive oil, sesame seed, peanut oil.
And you can absolutely eat them to your heart's delight.
The monounsaturated oils, they'll give us lots more energy, and they are not creating inflammation, which is at the base of every disease.
They're not creating any rust. They will heal your rust. Yeah,
they will.
All right. So hopefully you're going to read the story that I attached to the blog. So Pete, I just want to pick Peter's brain a little bit more because he's got all these controversial ideas, right? Pete likes to eat half a packet to a packet of butter a day, which is really good, and he's like super slim. So like he's actually proving that it works, right? And then Pete, you don't like when people get injured, and then people often get information. We see a lot of people who have old sites of injuries that the healing hasn't fully happened, and so Peter, you don't like the RICE method. RICE means
sports people use the RICE method: rest, ice, compression, and elevation.
And Peter is against it. Why are you against it?
I'm for rest. And maybe elevation, but the other two, compression and ice, are preventing the blood flow to the area of injury, so it won't heal properly. It prevents swelling, but that swelling is the blood going to the area to do the healing. And so we need the blood flow to go there to heal properly. If we stop it going there, it won't heal properly, and those people who have had the RICE or the ice and compression treatments end up with chronic problems later on in life. They'll need joint replacements and things like that. Whereas if you allow the body to heal itself in its time, in its own time, it will heal perfectly. But we need the blood flow there, and that causes swelling and heat.
And it makes it a bit more painful.
Sometimes pain. Yeah.
So that's what we see, like I said, in our practice. People with chronic pain after they finish their, say, career or whatever, sporting career or games or athletes. And now their body, now they're 40 and they have like these chronic health issues. So again, like I want to be positive here, even though the mistakes were made years ago, the body, we can literally reactivate the body's healing energy, right? And so the body will revisit those sites for proper healing. So it's not the end of the world. People always think like our bodies are like a car because we use those analogies to help you understand that you don't put salt water in your car, you don't put sugar in your body, but our bodies are different to cars as well, because like if you dent a car, you crash it into a tree, right? It's not going to recover, is it? But your body, you can dent it, you can bump it, you can bruise it, abuse it. We do that all the time, many people do that. And yet every year you have a completely new body. Every few weeks, like Pete said, you have new white cells. Every 3 months you have new red blood cells. Every 6 weeks you have a new liver. Your lungs repaired. They repaired within a fortnight. If you stop smoking, you have new lung cells and so on. So your body is literally healing all the time,
creating new skin all the time.
Yeah. So like if you have pain in your body, right, and the pain is lasting for longer than a month, that's chronic pain. Something isn't working, the wheels have come off the car, literally. You need to seek help, right? You can't just pull the flashlight from your dashboard, right? If
you injure yourself and normal healing takes place within 8 weeks.
Yeah.
So if you've got pain after that time, it's
something isn't working. There is like a kink in the cable, and you need to get expert help. and I'll just say we're the experts, or may as well say that because it's true. And we've seen this work many times, right? So, but tonight we just want you to know that it is this really awesome product, Immuno-Synbiotic X-Flam, and it actually is good for your gut as well, for your tummy. It's $53
for a month's worth.
For 120 capsules, which is like so super cheap. It's so cheap because we get it straight from the manufacturer, and the manufacturer
doesn't need to be kept in the fridge.
No, it's created by a doctor, second generation doctor in America, right? And this is a doctor who looks at your body functions the same way that Peter does with his testing. So I hope you find this interesting. So yeah, information is sneaky, like it's usually gone on under the radar for many years before you suddenly have diabetes, or you suddenly have a heart attack, you suddenly have Alzheimer. Nothing is ever sudden, all right? And so...
And you probably, if you have one of those things show up, pretty well you could say every cell in your body is inflamed.
Which is, by the way, is this good for children too?
Yep.
Okay.
They need it because we're feeding them a carbohydrate diet, which is causing inflammation.
Yeah.
So change your diet to low carbohydrate, low starch carbohydrates.
And more fats.
And a lot more fats.
Yeah, people go like, I want to clear this up, people think low carbs, they have to go high proteins. No, you go low carb, high fat, right?
Yeah.
Peter and I, we see lots of children as well, with heaps, a lot of success, right? So your child's life is literally turned around. If you have children, say, with problems like ADHD, or which is another form of inflammation.
Which is inflamed brain.
Yeah, we see that a lot, and like so behaviors, it gets pushed into the basket of behavior problems, but it's not behavior. It's their body isn't.
Yeah, low carb, high fat, and a probiotic, which
a good one though
could be this one, will give you your child its perfect nature back again.
That's right. So we have more probiotics other than this. We have quite a lot, plus enzymes are really good as well to break down information. And our products are, they're cost effective. So people will often go and just go to the supermarket, buy something off the shelf because they think it's affordable and it's good, or they've seen it on television. But they're often generic products with a lot of filler and not the high quality that you need. So, it sounds salesy, but Pete and I, we've spent like years and years, decades of research and just weeding out what's rubbish on the market. And we really only sell things that work for people, and they will work quickly, and they keep on working as well. And we do that ourselves, plus we also, of course, our children and our grandchildren benefit from everything that we do too. So anyway, I hope that you found this interesting. So that's information. I do a lot of energy work, but you already know that anyway. So like, if the cause of your inflammation is to do with an energy block, and that's caused by trauma, and Peter does that too, by the way.
Suppressed emotions also are chemicals in the bloodstream that are causing inflammation.
I can just grab it literally and chuck it in the sea. That's basically what I do. And it works. Yeah, that's just putting it in layman's term. I can see where it sits in your body, in your energy field, where it's causing disruption and unease and distress. I just pull it out and it's gone. So that works really well. So that's how I healed my own body after I got hit by the truck. So I hope you really enjoy this. Tonight,
keep warm in Tasmania.
Yeah, it's freezing.
It's snowing somewhere.
Thank you, everyone. I need better glasses still, but I see some names. Thank you, Tammy, Jackie, Antoinette, Jane, and everyone else that I missed before. Thanks for tuning in, and we hope to see you next Monday. If you have any pressing questions or anything, just let us know, and we can talk about that maybe. Okie dokes.
All right. Have a good week.
And I'll do a tune-up, quick tune-up to raise your vibration or frequency at 8 o'clock tonight on Grada Robertson Facebook, I believe. Okay. Thank you, everyone.
Okay. Have a good week.
Bye-bye.
See you. Bye.
Bye.